I've climbed the mountains in Montana, danced in the lights of New Orleans. Portland ran away with me.
Hello and welcome back to the channel. I hope that everybody is doing well today. If you are new here, then hi, my name is Brittany and I'm a nurse practitioner. I am also the creator of the Brittany Holzbeck NP Review. It is the most comprehensive, affordable, and it is accredited nurse practitioner boards review on the market. My boards prep and all of my other courses are available at www.thenewnp.com. I'll make sure to have the link in the description box below if you would like to go and check out my stuff. But all right, welcome back. It's been a little bit since I've been on here. It's actually been over a month, which is one of the longest breaks I think I've ever taken from getting on YouTube, and I've definitely missed creating content. As you can tell, I see a giant bird out my front window. As you can tell, I'm in a different setting. We have officially moved. I'm not sure if I've talked about it on here or not, but it's been a long process moving, and I'm officially settling in my new office. And so hopefully you like the new layout, and hopefully the sound sounds okay. I'm trying to work out any kinks here with my equipment. But for today's video, I thought it would be really kind of fun to take it back to some of my old stuff and go over some content that you need to know for your nurse practitioner boards exam. Obviously, I offer an entire course prepping you for your licensing exam, but I love to continue to add educational content here on YouTube that's free and accessible to everyone. And so I thought today would be a really great video if we went over 3 diagnoses that you absolutely need to know and master for your boards exam, and kind of talk about some key points, clinical pearls, hot topics when it comes to those diagnoses that you just need to have a familiarity with and a grasp with before you go in to take your exam. And so that's what today is going to be about. If you like this type of video, let me know in the comments below, or like it. It kind of shows me what you guys want me to put onto YouTube, gives me some feedback. And if you have any requests for future content, then let me know in the comments below. But all right, let's just get into today's video. So first up, hypertension. I'm sure you already know this, right? It kind of goes without saying that you must know and master diagnosing, treating hypertension. So hypertension, it's also known as high blood pressure, and it's a condition in which the force of the blood against the artery walls is consistently too high. And now this sustained elevation puts extra strain on the heart and blood vessels, increasing the risk of serious health problems like heart disease, stroke, kidney disease, and vision loss. So the CDC actually estimates that probably about half of the people in the US actually have hypertension. And it's estimated that probably only about a fourth of those people actually have their hypertension under control. And so this highlights a significant problem, a significant gap in treatment, awareness, and overall management of high blood pressure. And so it's no wonder that this would be a large focus on your licensing exam, because as I've mentioned in previous videos, your nurse practitioner licensing exam, the objective is to make sure that you are going to be entering into practice as a safe novice NP. And so being able to diagnose, treat effectively hypertension is going to be monumental in you being a safe provider. And so what are going to be some of the key components that you need to know in regards to hypertension before you go to take your licensing exam? And so I think a big one, and this is an obvious one, but I really want to emphasize that you need to have this mastered, is going to be knowing how hypertension is classified. And so the American Heart Association says that a normal blood pressure is a systolic less than 120 and a diastolic less than 80. And then hypertension stage 1 is a systolic between 130 and 139 and a diastolic of 80 to 89. And then finally, hypertension stage 2 is a systolic of at least 140 or a diastolic of at least 90. Just go in having those numbers tucked away in your brain and being able to identify if you're given a patient case scenario with a blood pressure, knowing how to classify if they do in fact have hypertension and if it would be stage 1 or stage 2. That's going to be very important for you to master. And then another key point that you need to know for boards, and of course always this applies to practice as well, is knowing that a single drug treatment is likely going to be unsuccessful in managing your patient's blood pressure if their pressure is 20/10 above goal. And so if they are diagnosed with hypertension and their blood pressure is consistently 20/10 above goal, it is very unlikely that one agent is going to be enough. And so you need to know first, of course, what our first line treatment options are for hypertension, but which medications are going to be indicated with certain comorbidities, which ones go together well, which ones are contraindicated, and just knowing which antihypertensive agents are going to be preferred for which populations. Next up, and this is probably another obvious one, but I would be doing you a disservice if I did not tell you that you need to have diabetes mastered, specifically type 2 diabetes. And now this is because the CDC estimates that 37.3 million Americans have diabetes. And of those, about 90 to 95% of them have type 2 diabetes. And now that is clearly a huge problem. That is a huge number. And I'm sure that you are familiar with what diabetes is. But first, we're just going to go ahead and define it, and then we'll get into a couple of key details that you need to know before you go and take your board. So diabetes is a chronic metabolic disorder characterized by high blood sugar or glucose levels, and it occurs because the body either doesn't produce enough insulin or the cells become resistant to insulin's effects. And so uncontrolled diabetes can lead to various very, very serious health complications. Things like heart disease, stroke, kidney problems, neuropathy, retinopathy, foot problems, ulcers. It can even lead so much as to amputations. And so uncontrolled, poorly managed diabetes comes with a slew of problems. And again, so it's glaringly obvious why your board's exam needs you to be able to master managing diabetes before entering into practice as a novice NP. So first up, one key detail that you absolutely need to know is that metformin should be started at the time of diagnosis unless there are specific contraindications. And you need to know what you should do if your patient reports side effects, unwanted side effects to metformin. And the most common one being GI symptoms such as diarrhea. And now what the literature recommends that you do is you go ahead and stop that metformin, wait for their diarrhea to completely resolve or their GI symptoms to completely resolve. But ultimately, they want you to trial getting them back on their metformin. If we can have our patients with diabetes taking metformin, if there's no contraindications, and we can get them to tolerate the medication, all of the literature points to we need to be doing this because it is so beneficial for them. So you stop the medication, wait for their symptoms to resolve, and then you start at a lower dose and you slowly titrate as tolerated. That is going to be a really key detail that you need to know when you're going in to take your boards is one, if we can get them on metformin, we need to have them on metformin. And two, what to do if they start to experience those nasty GI side effects. And then the other key point that you should know is when a second agent is going to be indicated. So the research says if the patient with diabetes has been, one, implementing lifestyle changes, so things like proper nutrition and exercise, and they've been taking metformin for 3 months and they're still not reaching their A1C goal, then a second agent should be added. And so, of course, be familiar with the second agents, which ones are preferred again for those specific populations, which ones are going to have increased risks, and ultimately really just build a familiarity with those medications. And then finally, the third and final diagnosis that we're going to cover today and that you need to master before boards is going to be dyslipidemia. And so this is an abnormally elevated cholesterol or lipids, and it is a risk factor for atherosclerotic cardiovascular disease. And so it's a no-brainer that this is something that we need to be familiar with and know how to diagnose and manage in practice to be a safe novice NP. The CDC actually estimates that about 38% of US adults have dyslipidemia. Again, a very large number. And the scary thing about this is that really there are no symptoms until complications arise. And like I said, it is a major risk factor for cardiovascular disease, but specifically, it is a major modifiable risk factor for cardiovascular disease, meaning that we as individuals, as providers, as patients, can do things to modify our risk. And so as always, one of the key components that you need to understand before going to take your boards is when a statin is going to be indicated for our patients with dyslipidemia, because statins are first-line treatment options for this disease. For starters, a LDL of 190 or greater is an automatic indication for a statin. And the way that I keep the LDLs and the HDLs differentiated in my mind is I think LDL is lousy and HDLs are healthy. So an LDL of 190 or greater, we don't need anything else. That is an indication to start a patient on a statin. And then from there, if the patient has an LDL less than 190, now we're actually looking at the specific risk of them having a cardiac event in the next 10 years. We can actually calculate our patient's risk for having a cardiac event by using an atherosclerotic cardiovascular disease risk calculator. You can Google it, but it is such an important tool, and it's really important that you are familiar with these numbers and what they indicate. Essentially, if our patient has an LDL less than 190, but a risk of 5% or greater for having a cardiac event in the next 10 years, we should be putting them on a statin. And then finally, it's really going to be important that you know what to do if your patient on a statin experiences muscle injury. Ultimately, the research wants you to be able to keep your patient on statin, but of course, that's going to be if you can do so safely and without side effects. And so there are a couple different options that you can do if and when this does happen. So one, you could restart them at a lower dose. You could switch them to another statin agent. You could attempt alternate day dosing with their statin, or you can even switch them to a non-statin treatment option. But all right, I think that's going to complete today's video. I noticed that if I make these videos too long, people drop off. And so I wanted to just stick with 3 diagnoses that you need to know for boards. And I can do a series of these if this is something that you're interested in, you find it helpful when you're prepping for your boards. Again, like I said, like the video, let me know in the comments below if this is something that you'd like to see more of. Also, if this is the type of video that you enjoy and you find helpful, you can check out my other videos where I go over medications that you need to know for your boards exam. I have a few of them, and I think that they are very helpful and very important for you to master. But all right, that is going to be it. As always, I wish you guys nothing but the best. Don't forget to learn something new every day, and I will talk to you guys soon. Bye guys.
But I wanna know how it feels to hang pictures on a wall.